where I'd like to start today is telling you a little bit about what I do. I'm a naturopathic doctor, and one of the questions I get asked most often by my patients or prospective patients, people I meet on the street, is what is naturopathic medicine? What does a naturopathic doctor do? To begin with, I love the fact that my medicine is holistic in nature. Holistic meaning it looks at the whole picture, your whole picture, your whole health picture. And your health encompasses not just your physical symptoms, but how you are doing overall as a person, as a human in the world. How are you feeling? So it looks at your physical, your mental, and your emotional well-being. It also looks at how those different aspects of self interact with one another and influence one another. Some people refer to this as the mind-body connection. And I think most of us who have been on earth for more than a few years have had some kind of experience at some point where we've seen that interaction in play. Perhaps you've had some kind of prolonged period of stress, or you suffer from anxiety, and that causes some kind of a flare-up of physical symptoms. A really common one that I see in my practice would be anxiety or stress coupled with flare-up of digestive distress, just as an example. Or it might be the opposite. It might be that you have some kind of long-term chronic illness or pain that you're dealing with, and over time you start to see that it really has an effect on your mental or emotional well-being. The point is that they influence one another and impact one another, and we shouldn't just pay lip service to that. So I aim to work with my patients in that holistic capacity. And when we talk about looking at a holistic perspective or your whole health picture, really that means that we need to be able to spend time with our patients. That's really critical, and it's something that I feel is a luxury of the kind of work I do with my patients. I typically spend 90 minutes with my patients in an initial consultation, and follow-ups are almost always an hour. So we have time to sit and talk, and I get to listen to my patients, something that is a unique experience a lot of the time for them. Okay, so we've established that we want to look at the whole picture and that requires a great deal of time and listening. It also requires other information like lab tests and possibly physical exams. So we do a pretty comprehensive and thorough assessment as naturopathic doctors to be able to really understand that whole health picture. And what that translates into is a naturopathic approach whereby we focus more on discovering the underlying cause of problems rather than just focusing on symptom management. So our conventional medical model tends to focus on symptom management and disease treatment, and a naturopathic healthcare model focuses on wellness and prevention. But when we have people come in that already have some type of a concern, some type of symptom or condition that's already arisen, our job is to investigate in the way I've described to determine what that underlying cause might be so that we can treat that rather than the symptom. Because if we just treat the symptom and by suppressing it, we're not actually making any sort of change. But if we can understand what's going on at the level of the organ system and its function, we can often actually improve that function. And then when we do that, the symptoms go away. That's really the goal. So organ system function, and not just individual organ systems, but how they interact with one another. So again, we have that holistic component coming into play here as well. So the last concept I'd like to introduce is one of the most important principles or guiding tenets of naturopathic medicine. In Latin, it's called the V Medicatrix Naturae, which translates roughly to the healing power of nature. And this is really key. Obviously, the root word of naturopathy is nature. And many of our patients come to see us because of the promise that we use natural substances as our medicine. And a lot of patients and a lot of people these days are interested in a more natural approach to their health and their lives, and that's something they're seeking. And that's definitely a key component of that idea that of the V Medicatrix Naturae, or the healing power of nature. But the actual philosophy or principle behind it, I think, is even more important to understand. So the healing power of nature refers to our innate natural ability to heal and repair, to maintain balance or homeostasis, and to prevent disease. The body is incredibly intelligently designed. It's really smart. And sometimes we forget that. But it's cool to take a step back and remind ourselves that it knows what it's doing. It's designed to do all of those things on its own. We don't need to tell it to do those things. It just does it on its own. For example, you've fallen and cut yourself, you bleed, the blood starts to clot, eventually a scab forms. At some point that scab even falls off and you have a little scar. But then one day you look down and you realize even the scar has knitted itself together and disappeared. So we didn't tell the body to do that healing and repair work. It just knew how, and it did it on its own. That's a great example of healing and repair at a macroscopic external view. But that's also happening internally on a microscopic level all the time. So the body is busy doing the job it already knows how to do of healing and repair, maintaining balance or homeostasis, and preventing disease. Here's where sort of my personal approach to naturopathic medicine trickles into that philosophy. I feel there are 3 key things that we need to do as humans, or that I need to do as a naturopath in supporting my patients to support that V medicatrix naturae, or the healing power of nature. Number 1, give the body the raw materials and tools that it needs to be successful. That's not rocket science, is it? So we need to give the body what it needs. And for me, that means a healthy diet, healthy lifestyle, and positive attitude. That's just sort of an umbrella term that I use to encompass everything else in the realm of sort of mental, emotional well-being, stress management, and so on. So positive attitude, great diet, and a healthy lifestyle is what the body needs to be successful at doing its job. Step 2. Not shockingly, it's the exact opposite. Remove any obstacles that you are putting in the way of the body being successful at doing the job that it already knows how to do. So again, it's just the opposite. So that might be some unhealthy dietary or lifestyle choices that are being made. And it might be a stuck point of some kind. Perhaps there's a lot of stress that's not being managed as well as it could, or perhaps there's some history of a trauma that hasn't really been fully moved through. So those are things that we would look at. Give the body what it needs, remove the things that are getting in the way of it being successful. So that's 1 and 2. And step 3 is where all of the other supportive therapies of naturopathy come into play. So I keep talking about diet and lifestyle, and obviously those are things that I would intend to work on with all of my patients, and that I see as the foundations of great long-term health, wellness, and prevention. And then the supportive therapies are what we bring into play when we already are seeing signs and symptoms. So there is some sign that there's an imbalance or a dysfunction in one or more organ systems. We want to give them a nudge back in the right direction to return them to natural, normal function. And that's when we get into all of the other therapies. For me, that might include the use of herbs, both Eastern and Western herbs. We also are trained, at least in my jurisdiction, in traditional Chinese medicine and acupuncture, so that might be one of the things that we use. We certainly might look at things like nutraceuticals, the use of vitamins, minerals, and other supplements therapeutically. We want to make sure that the organ systems are functioning properly in terms of elimination and detoxification as well. That's pretty critical in their normal function. So we would look at all of those pathways, and there may be things that we offer to help stimulate improvement in those areas. So to kind of sum things up for you, we've got a holistic paradigm where we're doing a lot of listening to our patients to really understand their whole health picture. And once we have an understanding of that, and we've identified the areas that may be the underlying causes of the challenges that they're facing, then we work in a supportive capacity to return those organ systems to natural and normal function. The primary modalities or treatment options that we use in our practice certainly would include dietary and lifestyle interventions, and then the other supportive therapies may come into play as well, which might be the use of supplements, herbs, acupuncture, and so on. So that's a pretty good overview of what I do and what naturopathic medicine is about. If you have any questions for me and you want some more information, feel free to post your questions here, or visit my website, or join my Facebook page, or follow me on Twitter. There are lots of ways to get in touch, and I'm really happy to have a dialogue with you about it. Okay, thanks for listening. Again, this is Jennifer Bear.